Today, from Anandamaya Wellness Center, we've come up with another webinar. We have been doing these webinars with an intention that we spread awareness about health, about disease management, and about natural healing solutions that are available in preventive health as well as managing a lot of diseases and disorders. So today, with the same intention in mind, we have come up with a webinar on irritable bowel syndrome. I think IBS or irritable bowel syndrome has been irritating a lot of us for the past few years now. It is raising, it's very prevalent these days. So let's talk about and understand what is irritable bowel syndrome, what can we do about it, how do we recognize it, and what are the natural healing solutions like acupuncture to manage irritable bowel syndrome. So to talk about that, we have Dr. Gurudat, who is hello, sir. So he's a core naturopath himself as a practitioner in personal life as well as professional life. He's had experience in working as a naturopathy doctor and a yoga doctor in many institutions before he started his own, that is Anandamaya Wellness Center. And here in his clinic, in his center, he's been practicing for the past 20 years. And it is wonderful to have him deliver his lessons, his understanding, his clinical and practical experiences of treating irritable bowel syndrome. Over to you, sir.
Thank you, Dr. Dipashri. It's been a pleasure for me to address this gathering today. As Dr. Dipashri mentioned, we have been conducting these webinars for the last few months, more than 6 months or so. Every second or first Saturday of the month, we plan one of the topics to talk about briefly, and also how different solutions can be there. And today has been our topic, IBS, or irritable bowel syndrome. I'll briefly go through about what is it and what are the solutions we can address to today to manage it. And when we nip the bud in the early stages, we can prevent a lot of complications which can come out of it, is what we need to understand. Most of the chronic ailments, you name it, hypertension, diabetes, and so many, including irritable bowel syndrome, gastritis, they're all lifestyle related diseases, chronic non-communicable diseases. When they're recognized at a very early stage and taken the right steps to control it, whether it is with medication, non-medication, lifestyle changes, we can nip the bud at a very early stage to make sure that it doesn't progress and cripple our life and our quality of life as well. In that event, let us discuss about irritable bowel syndrome today. I'll go with a brief presentation. Just give me a second. I'll share the screen.
Before Dr. Gurudat starts his presentation, I would want to let all of you know that if you have any questions during the session or post-session, we have a question and answer session after Sir completes his presentation. So if you have your questions, please post your questions in the chat box and we will address all of them in the end. Thank you.
Thank you, Dr. Dipashri. Let us try to understand irritable bowel syndrome and how we can manage with acupuncture, because acupuncture has been my core practice and the practice of Anandamaya Wellness Center for almost a decade and a half, nearly 2 decades. In about 2 years, we'll be completing about 2 decades of our practice in Anandamaya Wellness Center. So acupuncture, I'll come to that little later, the basics of it and how we understand and what is what, based on traditional Chinese medicine. There are several ways of practicing acupuncture, modern medical acupuncture and traditional acupuncture, but we stick to traditional perspective because that is much more holistic and not mere symptomatic treatment at all. Just like the modern medicine, which is having limitations of treating the symptoms and not be able to address the root cause. So let us go further. What is irritable bowel syndrome? As Dr. Deepashri mentioned, irritable bowel syndrome is irritating our human race, and it is only going to go up. It is not going to reduce with the kind of lifestyle, environment what we have. So it is very important that we need to understand this. Many of us would already be having some of the symptoms of this without recognizing it, or probably we don't understand it, and we may not even meet a medical doctor to address and understand this better. As the name itself indicates, there is irritation in our bowels, leading to gamut of symptoms which will cause our quality of life to deteriorate and also lead to a lot of other complications if left alone with untreated. We need to understand that bowel, large intestine, irritable bowel. Bowel means large intestine. So it is a functional disorder. In the sense, there is no structural disease as such with the large intestine, what we call it as a bowel. So it is, there are no structural differentiations or anything. It's mostly abnormal contractions of the large intestine. We need to understand that our small intestine, right from our mouth till the large intestine, and the large intestine itself till the anal region, will have what we call it as peristaltic movement. Peristaltic movements are nothing like, just like heartbeats, pulse, and the nerve functioning of impulses going through the nerves, blood flowing through the blood vessels. Same way, intestines also have to move. It's a peristaltic movement, what we call it as. That peristaltic movement helps the food to pass through, and churning mechanism or digestion functioning happens very well. At the same time, absorption, assimilation, all those digestive functions are also taking place when peristaltic movements are there. If there are abnormal contractions, which happens in irritable bowel syndrome, that is where the problem starts, leading to a lot of symptoms and our quality of life going down. Irritable bowel syndrome is nothing but there is an abnormal contraction of our large intestine. And IBS is one of the most diagnosed gastrointestinal disorder or disease today in the population. Now, one of the articles I was reading very recently about IBS was that about 40 to 50% of people, maybe about 30 to 40%, if I'm right, if I remember correctly, suffer from IBS at one or other point of their time in their life. So can you imagine to what extent this is prevalent? Maybe mild, moderate, severe, depending on the condition they are. So it varies from individual to individual what kind of symptoms they have, but that is the amount of morbidity it has on the human population. And there is no specific age group where it can develop or it won't develop, or gender-based discrimination, nothing. It's mostly found in all sections of people, irrespective of their age, and mostly middle age and late old age is where, mostly middle age is where we find IBS to come in. You may see one of the pictures in the picture mentioned here, muscular layer. See, a large intestine has three layers: outer muscular layer, submucosal layer, just below that the whitish color which is there, and the inner pinkish color is the mucosal layer. In irritable bowel syndrome, all the problems is happening in our muscular layer. That is where the abnormal contractions happen. Let us go into the detail of that little later. But before that, let us understand what are the functions of large intestine, so that we can understand what are the symptoms which can come along when we have this disease. There are four major functions of large intestine. Let us understand that. As you can see in the picture, large intestine consists of different parts, as you see here. This is the what we call it as, there is a small intestine between this large intestine, and the last part of the small intestine is called ileum. From ileum, whatever undigested food particles are there, that is transferred to the large intestine. There is a valve here, ileocecal valve, cecal valve. That means to say that whatever food, undigested food matter comes from the small intestine to the large intestine. it is not going back to small intestine, with the valve being one way, not allowing it to go. And then we have this portion of the large intestine is called cecum, and then this is the ascending colon or large intestine. This is transverse, which means it is longitudinal, and then descending colon, which is coming down, then the sigmoid colon and rectum and anal region, which comes along. These are the parts of the large intestine, as we can see. It is there in our abdomen, middle portion of our body. And there is appendix, which is attached to the cecum, and it is understood that it is a remnant of the evolution which doesn't have any functions, is what we understand today. It might have some functions, but we have not discovered it yet. So we consider that it is non-functional, or we don't have any functions, but there must be some which medical science has still not understood very clearly. And this is what at times when they have improper lifestyle and all those factors or any infection, this appendix can get infected and lead to severe emergency abdominal pain, and it need to be operated upon if not left. If left alone like that, can lead to a lot of infection in the large intestine and the peritoneum, in the surrounding structures. That's why it becomes an emergency when appendix is infected, it has to be removed. And it is called vestigial organ because even after removal, there won't be much change in our day-to-day life. Probably we don't know, or we are not really, we have not really understood about that. Let's leave it about that. So that is how the large intestine is all about. So what are the main functions of it? Now we have understood the structure of it. Let us understand the function of it. In this picture, you can see how the GI tract comes right from the mouth through the esophagus, stomach, and the small intestine and the large intestine. The red color is the large intestine, and the white color is the GI tract, which is there. So this is to give a rough idea of how this our GI system is structurally present in our body. There are 4 different important functions of large intestine. First one is the undigested food matter which comes into the large intestine needs to be stored and formed into a fecal matter. Fecal matter happens because of several processes which happen in the large intestine, which is eligible for defecation, to eliminate. We need to understand there are 4 important organs in our body which are called eliminatory organs. One of them is colon or the large intestine. The others are kidney, skin, and lungs. Lungs expel carbon dioxide. Kidney respirates with sweat, interacts with the environment, and skin interacts with the environment, and sweating happens. Kidneys filter our blood and takes out unwanted biochemicals from our metabolites. Post metabolism, there are so many chemicals or biochemicals which needs to be eliminated and need not be kept in our body. So that is taken care by kidney. So of them, all of them are quite important, and large intestine is equally important. And it is most easy to work with the large intestine to detox ourselves. That is one important. Skin and large intestine can be very easily taken into a detox stage. Those are the first 2 organs which come into action when detoxification process starts, when we give an opportunity. So the first function of our large intestine is to form the fecal matter or stools, storing it and eliminating it. And second one is reabsorption of water and mineral ions like sodium, chloride, and all. Most of the water content is reabsorbed in the small intestine itself, up to 80%. Rest of the 20%, when the undigested food matter comes into the large intestine and fecal matter is processed or happens, then 20% of the water is also may not be 20%, maybe 15 to 18% of water is also reabsorbed, because it's valuable for the body to sustain a balance in the fluids and the pH levels. That's why it is reabsorbed. All good ones are reabsorbed. Some of the sodium chloride ions are also reabsorbed from the large intestine. One of the most important functions of large intestine today is the maintenance of about 500 species of bacteria. They are called anaerobic bacteria because they function only in an environment where oxygen uh, doesn't exist. So that is where large intestine is, where oxygen doesn't exist. And these species of bacteria are the one responsible to turn your undigested food matter into fecal matter. In the event, it will release a lot of gases also, and those gases are responsible for feeding those bacteria to be there. And let us understand that these bacteria are not our enemies. We have always been thinking about that and causing a lot of disturbances to our own system. It has been understood today with scientific evidence that these bacteria are called commensals. Commensals are friendly bacteria which is required. We symbiotically we exist together in our system. So to what extent the research has gone today and understanding is that these species of bacteria is not only functioning to get the fecal matter or undigested food matter into fecal matter, but also has a lot of function. To that extent, it will interact with our immunity. And many people, many scientists are of the opinion that today, if your gut health is good, your brain health is good, your immunity is good, your mental emotions are good. So it is very important for us to understand today that how to maintain the gut health. That's why many times you will tell, take probiotics. The moment you have a diarrhea, the first course of action before starting antibiotics is probiotics. Probiotics are helpful bacteria or commensals good bacteria, which is responsible to maintain a balance. If there is imbalance between the good and bad bacteria, that is when it leads to diarrhea and lot of other complications in our large intestine, lot of other symptoms in our large intestine. So large intestine is called the second brain actually today. I'll come to that because several recent studies have indicated that the nerve functioning of the large intestine is so intricate and so strong that it is almost like a second brain. And any changes in the brain in terms of our emotions and other neurons functioning will affect our gut. And gut has any disturbance will affect our mind and emotions. One simple example is if you're stressed, if you're under a lot of pressure, maybe you have to do a presentation, maybe you have to attend an examination, or you have to attend an interview, which causes a lot of anxiety. You may feel that I want to pass my bowels, just like I want to clear my bladder, just like that, same thing. So there is a strong connection between brain and the gut. That's why it is called the gut is the second brain. Many times we feel my gut feeling is this. What does that mean? So it is also instinctively giving you some signals. So gut is so important. Gut means transverse, colon, large intestine. So that important today, what colon is all about. And fermentation of last function of the large intestine is fermentation of indigestible food material. Whatever food is not digested in our small intestine and not being able to absorb, that comes to the large intestine, and these bacteria which are there will help us to ferment it and try to eliminate it. That's where a lot of gases are secreted. And if you have certain kinds of foods which are more gassy in nature, or what we call in terms of Ayurveda vata related foods, then automatically there is a lot of gas accumulated and we pass through anal region many a times as farts. So these are the main functions of large intestine. Now let us try to understand what are the symptoms and causes of IBS or irritable bowel syndrome. First, let us understand what are the main symptoms which comes along when we have a irritable bowel syndrome going in us. Most important thing is cramping and bloating. As I told, the function of large intestine is to store the undigested food matter and fecal matter and fermentation. When it is stored for a long period of time, when there is a disturbance in our muscle contraction, you see the causes, one of the causes is disturbance in the muscle contractions in the large intestine. Will that, when excessive contraction or sorry, the contraction is low or more than less than desired, it can lead to cramping and abdominal pain And many a times because of the dysfunction, it can lead to bloating also. As I mentioned, other symptom is excess gas. Because of this disturbance, there is excess gas as well in our large intestine. It can lead to diarrhea and constipation as well. Sometimes it is loose stools, sometimes there are no stools because of this abnormal contraction. When the bowels, large intestine is moving properly, automatically all the undigested food matter moves through the large intestine and it comes to the last partum, the rectum, which gives the signal for us to empty when it is full. So when there is no proper volume coming into the rectum, there are no symptoms or signals coming to our brain to eliminate our undigested food matter or fecal matter. That's when this diarrhea or loose stools happen. And also because the stools stay for a long period of time and abnormal contractions are there or inflammation is there, mucus in the stool is also possible. Generally, irritable bowel syndrome, we don't have blood all passing through, but mostly mucus is the one which comes along with these other symptoms as well. What could be the causes basically? Let us try to understand, as I mentioned just before this, that abnormal muscular contractions is one of the main reasons for IBS. The same way, nervous system, dysfunction of nervous system means, as I told in the earlier one of the slides, the different layers of large intestine is muscular layer, submucosal, mucosal, serosal. These layers are there in the large intestine. When there is disfiring of the nerves, nerves are responsible for the contractions to happen. So when there is dysfunction in the nerves of the enteric system, I have forgot to tell you about this brain-gut connection, this specifically we have what is called as central nervous system and peripheral nervous system in the nerve, the whole of the nervous system. Now they are coming up with another concept that the gut itself has its own nervous system called as enteric nervous system. Enteric means intestines. That specifically has a nervous system by itself. If there is some dysfunction, misfiring of these nerves, that can lead to abnormal muscular contractions. That is one of the causes which is known today. And inflammation in the intestines. Inflammation is nothing but basically, inflammation is a protective mechanism to protect ourselves from different pathogens and environmental toxins and environmental changes. But when it becomes chronic, consistently happening, then it leads to inflammation. That is what is called as chronic inflammation in the intestine, which can cause abnormal contractions in our large intestine, leading to IBS symptoms. And there is one more hypothesis, or probably one of the understandings of many scientists today, is severe infection is also one of the causes of irritable bowel syndrome. And changes in the microflora. We talked about commensals, good bacteria and all. If there is a minute change, the changes can happen for various reasons, because our food habits, environment, and our lifestyle, excessive use of medication of any different kinds. So that's why when you take some antibiotics, you have diarrhea also. That's because there is change in the microbiota of the large intestine. That's why many doctors will prescribe along with the antibiotic a probiotic to maintain this microflora, which is responsible for functions in the large intestine. So these are the causes which leads to irritable bowel syndrome. Behind this factor, I would like to say lifestyle and environment today is a major cause for irritable bowel syndrome. How we live our life, how we take care of our body is very, very important, including how we eat, what time we eat, how we sleep, what is our quality of sleep, what is our exercise regimen, how we keep our mental health, how we function with our relationships at home, professional life. Everything matters. All these things are holistically working, which when becomes beyond a certain threshold, stresses, emotional factors, food habits, just taking care of our tongue needs and not the body needs, automatically it will lead to a lot of imbalances in our system, leading to these changes, the causes what you mentioned. If you ask what is the cause of the causes, then it is lifestyle. That is what I would like to mention here. So this is what IBS understood as in the modern perspective. Let us try to understand a little bit in terms of traditional perspective so that we know how holistic it is in terms of traditional system and how we can address it. We mainly address IBS in our clinic with multiple tools. The most important tool is acupuncture, based on traditional Chinese medicine, or TCM, what we call it as, and yoga therapy, and working on your diet and exercise. And of course, counseling when required with anxiety, depression also, which may be accompanying with IBS because of the gut changes and the enteric nervous system changes, leading to a lot of emotional changes, as we discussed earlier. So they are interconnected. Gut changes can lead to anxiety, depression. Depression and anxiety can lead to gut changes as well. So 1 second. Excuse me for just a second. Okay. Okay. There was some sound disturbance, so I had to check what it is. I hope you're all hearing clearly. If you have any difficulty, please put it on the chat so that we can address that. Causes of IBS according to traditional Chinese medicine. That is very important. Traditional Chinese medicine or yoga therapy or naturopathy all deal with health being a state of balance, homeostasis. All the functions of the body are in a state of equilibrium. That is what traditional medicine believes, whether it is yoga, naturopathy, Ayurveda, homeopathy, Unani, acupuncture, TCM, all believe in the same concept. I have someone asking. Okay, thank you, Sandeep. Right. So all alternative system of medicine thinks that balance or homeostasis is a state which we need to be in state of health. When there is an imbalance in this, is what leads to disease. So in terms of TCM, we have what is called as, according to traditional Chinese medicine, balance is maintained by proper flow of energy. Energy means chi or prana, what we call it as. It is invisible to our naked eye, but without that we can't live. One of the simple examples is prana. Traditionally in India, we always talk about if someone passes away, his prana left his body. In local language, that's what we talk about. See, can you imagine how important the prana is? Without which, the breath, without which we cannot survive. Irrespective of your brain also cannot survive, however strong it is. So prana or chi is nothing but an invisible energy which flows in our body. And in TCM perspective, it flows in different meridians and submeridians and collateral meridians to supply that chi to every cell and organ of our body, so that it carries on its functions and helps us to maintain a particular quality of life to perform our necessary duties or responsibilities or life as such. So because of many lifestyle abnormalities, maybe waking up late, not exercising, sitting most of the time, which leads to stagnation of chi, and improper eating habits, taking care of only the taste and not the nutrients, and not being holistic about it, not having seasonal foods, can all lead to a lot of variations or chi or prana imbalance or deficiency. So when that happens, that is what leads to one of the causes of IBS. In IBS, what we have seen is if there is a deficiency and stagnation in our energy of the GI, gastro-intestinal system, we consider that as spleen and stomach in TCM. TCM is almost 5,000 years old. During that time, there was no terminologies as we have in medicine today. That's why they considered large intestine as a separate organ, a separate energy meridian. Along with that, stomach and spleen also having a considered as the meridian for GI system, gastrointestinal system. That includes large intestine as well. So when there is a deficiency of chi or prana in this spleen and stomach energy, that's what mostly leads to IBS. That may be because of imbalance in the prana, chi flow in these meridians, or stagnation. Either of them can lead to deficiency. Most of the time we have found that deficiency is the cause of that, leading to all the symptoms what we are talking about. Diarrhea, constipation, gassy formation, and a lot of gas passing through the anal region, and abdominal pain, cramps, all these, and leading to a lot of emotional upsets, anxiety. Also, it is because of this deficiency. Behind the deficiency, stagnation and imbalance. Behind that is our lifestyle. These are the factors which are responsible for IBS according to TCM. And also stress and emotions also play a very big role. In TCM, every organ has one emotion attached to it. For example, anxiety is related to mostly heart channel. Fear is related to kidney channel. Overthinking is related to spleen and stomach, gastrointestinal system. Sadness is related to large intestine and lung. So if any of these emotions, for example, overthinking, most of the time overthinking is related to spleen and stomach energy. Sadness is related to large intestine and lung. So then what happens is, when these emotions are too excess for various reasons, maybe in terms of our personal life or professional life, or our processing of our information mentally with the emotions are not very able, then that leads to all this stagnation and imbalance, further leads to deficiency. And when these imbalances are there, that in turn leads to imbalances in our emotions. We don't have a clear thinking at that point of time. So that is where it's a vicious cycle we get into. That's what leads to this dysbiosis or dysfunctioning of the chi or prana in our specific meridians, leading to IBS. Stress and emotions are equally important. Then the pathogens. Pathogens are nothing but virus, fungi, bacteria. We spoke a lot about it. Even TCM believes these are responsible for IBS. I hope you have understood what is the traditional perspective of what IBS is all about. Now let us understand what are the solutions for this. In terms of modern science, I would say normalizing the contractions of large intestine, balance the neurological action on large intestine. So these two are very interrelated. Neurological action becomes better, automatically contractions become better. Contraction happens because of neurological functioning. When the neurons or the nerves fire, muscles contract. So if these two functions are the goals of the treatment when we have to manage IBS. Let me tell you, I always mention it as management and not cure. Cure means you have to get off the complaint and never get it back. Mostly, you should not get back the symptoms again. Management means many a times when there are chronic conditions and there are several factors, as we have understood, which can lead to this IBS, how many factors you can recognize and also manage very effectively. It's very tough in our lifestyle today to manage that. If we can do that, we can also assure about a cure for IBS. But many a times, many factors are beyond our control. That's the reason when we don't control, we have to manage that effectively. Manage with several tools of therapeutic tools, including yoga, dietary changes, acupuncture, maybe at times medication, all these ones which will help in the management of IBS. 90% of management is almost equal to a cure. We should not look at 100% cure many a times, because we don't have many factors in our control many a times, if not all the times. Then restore the balance of gut microbes, reduce the inflammation and infection management if required. If the infection is most important, then infection management is also needs to be taken care when we recognize for IBS to be cured. And reduce the inflammation in the large intestine. Inflammation, as I mentioned, is one of the major factors today for IBS. How do we manage? Healthy lifestyle is one of the major reasons. Now, Western system of medicine, allopathic perspective, they're coming into the perspective that anti-inflammatory diet, anti-inflammatory lifestyle, are going to be major tools or major way of dealing with several of the chronic non-communicable ailments, including IBS, cancer, you name it, all those degenerative neurological conditions, arthritis, and all those things. A anti-inflammatory healthy lifestyle is what the answer is on a long run. Medication is just one single part of it, but rest of the things are equally important. If that anti-inflammatory lifestyle is not taken care, automatically the effectiveness of medicine reduces. We become more dependent on medication and leads to more complications, and aging becomes much quicker and our quality of life deteriorates. Morbidity is very high at that time. So we have to follow what guidelines the doctor gives you about healthy lifestyle. That will pay you off like an insurance on a long-term basis. And to restore the balance of gut microbes, how do we restore it? By proper healthy diet and nutrition. So this is how we manage the IBS with the goals, and healthy lifestyle is one of the major factors for that. When I say healthy lifestyle, proper exercise. Let us go one after the other. Exercise is very, very important. Human beings are not designed for stagnation or sedentary life. We are supposed to be active and moving. When we don't do that, it leads to a lot of complications. To that extent that sitting has become one of the major factors for inflammation to rise these days. That's what the science has come to understanding, even though traditional systems of medicine have been telling about that since a long time. And drinking adequate water. It varies from person to person and region to region, geographically and the climatically. So we have to adequately hydrate ourselves. And eating sufficient vegetables, more and more vegetables, because they are rich in microbes, they are rich in fiber, they are rich in all the water content, minerals. So it is very important that we have sufficient, adequate vegetables. And get enough sleep. That will help us to manage our emotions very well. Sleep is one of the factors which will help us to repair and recuperate throughout the night. So if you have a very comfortable and sound sleep, automatically your nervous system functions better, your emotions are functioning better. And when that happens, automatically you will lead to a healthy lifestyle, leading to management of all these symptoms of IBS. And stay mindful. We need to be mindful in the sense we are not either living in the past nor in the future. At the present moment, what I'm doing, I'm completely into this. I'm not thinking about my next appointment or what happened to my previous appointment. What is my plan tomorrow? What was my plan yesterday? That should not be the thing. When I'm focusing on one treatment with the patient, I'm completely in that. If I'm having my food, I'm completely focused and working on my food, the mindful eating. That's what we do about it. That's very, very important. And then get some fresh air. Air is very important. Most of the buildings in urban life today is so constricted. I would say very constricted, where there is no enough fresh air coming into ourselves, into our homes. That will lead to a lot of stagnation of energy in terms of TCM, if I have to call it as. So it is leads to a lot of stagnation and stale air. And when we breathe that, automatically you're not that much energetic, you're not oxygenating yourselves sufficiently, leading to a lot of other complications and diseases. It's not diseases, it is a factor which will help us to get ourselves into disease. And regular detoxification. Fasting has been advocated in most of the religious practices only for the reason that you maintain your health. It is nothing to do with the God. God will not get impressed if you fast. If you fast, you become healthy. When you become healthy, you can think better. You can think holistically, and you can contribute to the society, yourselves, and to the family. That's why detoxification on a regular basis is very, very important. And that will be leading to healthy lifestyle and management of IBS. Just like eat more vegetables and more fruit also into your food. So a healthy lifestyle and these goals of managing IBS will certainly lead to very well managed IBS to almost cure possibility is possible. I hope you have understood about this. We'll go to the next thing, and how acupuncture can help. That is the crux of the whole thing. But I have to tell you all these things before I can talk about this. Acupuncture involves inserting very fine needles. These needles, as you can see in the picture, are so fine, as thin as your hair, are inserted in specific acupoints which lie on the meridians, energy pathways, where the chi flows, the prana flows. We recognize that what imbalances are there after detailed consultation of not just understanding your symptoms, but also understanding about your lifestyle and how you are living, how that is contributing towards the imbalances. That happens in a detailed consultation. And once a detailed consultation happens, we understand what the imbalances are, whether it is deficiency of chi, stagnation of chi, or improper flow, stagnation, and then excess flow of energy or deficiency of chi. This is what we understand through the consultation according to your symptoms and lifestyle. Then we select different points on the meridian wherein we insert acupuncture needles with a very skilled manner without causing any pain or difficulty. I have been doing acupuncture for almost like 24 years. Very rarely, very less percentage of people are, of course, a lot of percentage of people are fearful about it. But when we have 1 or 2 sessions, they'll realize, oh, only this much, this is not a big deal. So we don't have to fear about it. So when that is inserted on the specific meridians, these are the changes which happens in our body. It reduces inflammation. We talked about it. What is inflammation? Balances the neurochemicals and restores normal functioning of the nerves of large intestine. Whenever a needle is inserted, it has been found in studies that there are a lot of neurotransmitters which are released, which will restore the normal functioning of the nerves. Not just that, acupuncture also helps in stress and emotional management. All the emotions to be balanced. That we have seen a lot, because the moment an acupuncture session is done, most of them feel, I'm so relaxed, I'm so relieved, my anxiety is much better. So it is very, very important to understand that we just don't address only the imbalances and symptoms, but also we address the emotions. That is why it is holistic. It addresses your body, it addresses your prana or chi, it addresses your emotions as well, and restore the normal functioning of the large intestine. That's how acupuncture can be a very effective tool to manage IBS. I hope this is fine. If you have any questions, you can please post it. Before I before I conclude and get to question and answer mode, couple of case studies I want to share. This is about one of the ladies who approached us. This is about 3 years back, I think. She approached us with the symptoms of IBS, typical symptoms of IBS, anxiety, depression, bowel disturbances, and a lot of anxiety about health. And she had lost weight a lot because of malabsorption. And she was so thin. And every day she is having bowel issues, loose stools. And she also had GERD, anxiety, and all. So she was a 47-year-old lady, and we had, after detailed understanding of the case in the consultation, we had took the acupuncture to be a major therapeutic tool to address her complaints, and we did for more than 3 to 4 months on a very regular basis. She was very consistent, and she was very, for acupuncture, and she had a lot of trust and faith on the system and the ourselves, so that it helped to a large extent. Even today, I'm in touch with that lady. Many a times she calls for many other symptoms whenever she comes, not for IBS. Let me tell you that. If she had a little bit of allergy, or if she had some emotional ups and downs, she will call for that. If she has some pains, what can we do about? If she has some sleep disturbance, what can we do about it? Through acupuncture or through home remedies of acupressure. That's what she calls for. She has never called us till now for the same complaints what she took acupuncture for. That she recently suffered from COVID, and post-COVID she had some symptoms. She had called mentioning that, doctor, I don't have the IBS symptoms, but these are the residual symptoms which are there after COVID. How do we address through acupuncture? Acupuncture can be very, very effective in many symptoms, many conditions. Thereby, IBS also is one of the, and there are several studies to indicate that. I'm sorry, I forgot to put the study which I referred to while finding all this. Probably that I'll share when required if anybody asks me about the study which was done about how IBS can be helped through acupuncture. And another lady whom we have been treating for more than 8 to 10 years for different complaints. She is a typical case of IBS and anxiety. Even today morning, I have treated her, and she is also way better in terms of, in the last 3 years, she has developed IBS, but it's almost gone. It's almost gone. So once in a while it flares up, but that depends on several factors, as we have understood, which are beyond our control. But she's almost like 70 to 80% better than what she was. So we have done this purely with acupuncture, advice and sessions with counseling, and talking to them about their needs of emotional needs, and addressing their lifestyle through proper yoga and dietary changes. What is required is what we address to. These are only 2 cases. There are several cases, men, women, to have IBS, and we have treated successfully. I conclude with that, and I hope I have given a comprehensive view about acupuncture, traditional Chinese medicine, and what is IBS. If you have any questions, I am open to it.
Please post your questions in the chat box, and we'll take those questions one by one. Thank you.
Always it has been mentioned in our colleges and also in your case, whenever you attended classes, you will be very well knowing that in 2 conditions there will be no questions at all. Either you have understood completely or you have not understood completely. Either way, yeah, we have got no questions. Dr. Prasanna Lakshmi is mentioning that webinar was very informative, clarifying many of my questions. Muralidhar Ramaram is telling, thank you for the good session. IBS does occur due to kind of food what we eat and because of indigestion. Thank you, Murali, and thank you, madam. I'm happy that I've been able to give the necessary information and clear many of the doubts of yours.
If there are no questions, we would also request you to suggest the topics for webinars that you're looking forward to hearing from us, and we would be glad to take them for our upcoming webinars. And we will also keep you informed about the webinars that we'll come up with. And also, please visit our website, please visit our Facebook page, our Instagram page, our YouTube page, all with the name under Anandamaya Wellness Center, and you have a lot of education and awareness materials on health, well-being, and disease management. With that, we'd like to come. Yes, sir.
We have one question coming up. I just saw, yeah. Sandeep is asking, sir, how many days does it take to reverse the situation? Sandeep, it varies from individual to individual. That's why a detailed consultation is very important for us. Many a times the consultation goes beyond a certain time period. Even though we assign about 45 minutes, it goes up to 1.5 hours. During that time, we have to understand the root cause of the condition, and also how long would it take, how long they have been suffering, how long they have been taking medication, because medication suppress, not all kinds of medication, modern medicine suppress the condition. So we need to understand all those factors. I would say minimum of 1.5 months to see some changes, and on a long-term basis, it can go up to 3 months to 6 months of therapy to be needed to address most of the symptoms. And I always tell that even after your symptoms have gone, it is not that it is completely gone. It is very minimal, very, very minimal, not affecting your day-to-day life. During that time also, you have to maintain the lifestyle. Thereby, if you're maintaining your lifestyle very well, you may not need the therapy. And once in a while, if you have the therapy, what are the imbalances are there, that gets corrected. So on a long-term basis, acupuncture is to be seen not just as a therapeutic tool, but also wellness tool on a long-term basis to maintain health. That's the perspective we have to go with.
So there's another question. If we do not have knowledge of TCM, is it manageable by modern acupuncture also?
Yes, Kanchan, it is possible to address through modern acupuncture as well, but it will have a limited effect when we address only the symptoms. If we are going through more TCM perspective, it is much more holistic. Then we address the whole person as a whole and not treat just the symptoms. We are not supposed to treat IBS. We are supposed to treat the person. That's why TCM and alternative system of medicine, even though they mention the same complaints, two different individuals, we have two different treatments. In modern medicine, it's almost similar. Here, it is based on symptomatic basis. So here, TCM knowledge is very necessary, or it will be a great tool to have an effective outcome of the therapy. I hope that answers your question. You're most welcome, Sandeep. Thank you, Kanchan. In case if any one of you want to contact us for any of your health issues, not just IBS, these are the details what we have. Dr. Deepashri already mentioned to you, we are available Monday to Saturday, 9 to 6 p.m. with the appointment. As you know, as I mentioned, we take quite some time for consultation and the therapy. So we need to book an appointment at the numbers what we have mentioned to approach us, and you can even WhatsApp us on the same number to book an appointment and take it further so that you feel much more healthy. We have to really focus today on health rather than the disease. You should not, it's not necessary we have to approach the doctor only when you are having a disease. It's important we approach when we are healthy. That's what I would say in my experience. Any more questions? Thank you, Murli. Thank you, madam. I didn't want to share your case study here because you are there in the thing, but you have mentioned because of the inflammation of the small intestine, you have approached me and it is almost gone right now. It's not just my effort, it is also your belief on the system and on our treatment that it has helped you to be this much better. Thank you so much. Well, I would like to thank you all for giving the time, valuable time on a Saturday to spend with us for the webinar. Dr. Deepashri will conclude.
Yes, so I think the comments that came in the chat section definitely gave us confidence that what we've been talking about was understood and received well. So first of all, thanks, a very huge thanks and a heartfelt gratitude to all of the participants who made time on a weekend to come and sit with us and understand what irritable bowel syndrome is and how we could manage it. We would be glad, like I said, to receive your suggestions on the topic that you want us to talk about in our upcoming webinars. Please keep us posted. You can contact us. You can send us a mail with your suggestions, and we'll be happy to take them. With that, we wish you a very happy weekend and hope to meet you in our upcoming webinar. Thank you.
Thank you all.